Subcutaneous fluid therapy administration is an effective treatment for cardiovascularly stable animals that are dehydrated or require fluid diureses. Two examples of situations that often benefit from subcutaneous fluid administration include brief episodes of vomiting or diarrhea and chronic renal failure. Subcutaneous fluid administration is not an effective means of replacing lost fluids in animals with severe intravascular volume depletion, which can occur with prolonged vomiting or shock. The other significant benefit of subcutaneous fluids is that the animal can be treated and released to its own environment in a matter of minutes. Intravenous fluids do not usually offer this outpatient treatment option. The following materials should be prepared before you begin. For a patient that is greater than 10 pounds, you will need the fluid to be administered. This fluid should be carefully chosen by the veterinarian to meet the metabolic and electrolyte needs of the individual patient. A macrodrip fluid administration set, a 20 or 18 gauge needle, 4x4 gauze soaked with isopropyl alcohol, and hair clippers for some patients. Patients that are less than 10 pounds will benefit from the use of these additional items: 12, 35, or 60 milliliter syringe, depending on the patient, a 20 or 22 gauge butterfly catheter. To begin, wash your hands thoroughly. Remove the fluid bag from its protective plastic covering and date the bag using a Sharpie or a bag label. Attach the fluid administration set to the fluid bag and then compress the drip chamber at the top of the administration set and partially fill it with fluid from the bag. There is generally a small fill line imprinted on the chamber. Open the fluid line by opening the clamps and removing the caps, and then allow fluid to completely fill the administration set. Be careful not to touch the tip when the cap is removed. Close the fluid line once fluid drips out of the open end of the line and inspect the line for air bubbles. If air bubbles are present, reopen the fluid line and allow the air to flow out. If air bubbles are near the top of the line, you may be able to force them up into the chamber by holding the bag above the line and tapping the top of the line. Attach the 18 or 20 gauge needle to the end of the administration set. When administering fluids to very small animals, it is often beneficial to administer the fluids from a pre-measured syringe. A butterfly catheter will compensate for any unpredicted movements during the injection process. First, select an area where the skin is relatively loose and the subcutaneous space can hold the fluid being administered. Desirable areas include in between the shoulders, over the back, and over the neck. Using the alcohol-soaked gauze, separate the hair and clean the area where the fluid will be injected. If the hair is dirty and or matted, you may choose to clip a small 1-inch patch of hair at the site. Once the area is cleaned, insert the needle under the skin and into the subcutaneous space. After you have inserted the needle, open the fluid line and check the flow by watching the drip chamber. If flow is not occurring, ensure that all clamps are open and reposition needle under the skin. Squeezing the fluid bag or hanging the bag up higher may help to increase the flow. If a butterfly catheter and syringe are being used for a smaller animal, inject the fluid contained in the syringe. You should attempt to limit each injection site to 150 to 200 milliliters. Injecting more than this amount will likely create some unnecessary discomfort and slow the absorption from that site. Once the desired amount of fluid is administered, clamp off the line and remove the needle. Pinch the skin around the injection site for approximately 1 minute to prevent leaking. Reassess the injection site a few minutes after administration. If excessive bleeding, bruising, or fluid leaking is seen, the attending veterinarian should be alerted. If a small or hypothermic animal is receiving fluids, utilize a warmed bag of fluids to help restore and maintain body temperature. Fluids can be kept warm and ready to use if they're stored in a temperature-regulated incubator set no more than 100 degrees Fahrenheit, as shown here. They can also be placed in a microwave and warmed at high, stopping at 30-second intervals to shake the bag and mix the fluid. The fluids should be warm to the touch without being too hot to hold. The warm fluid bag can be covered with plastic bubble wrap or a heating blanket to maintain a warm temperature. While the fluid is being delivered, the line can be placed under a heating pad or it can be run through hot water. Inline fluid warmers, like this one, can also be purchased, but they are limited to one-time use. Unintentional fluid overload can be very dangerous. This problem is particularly a risk in small animals or animals with less tolerance for fluid overload. Examples of animals with less tolerance include those with heart disease, lung disease, or head injury. The animal receiving fluids should never be left unattended. When the subcutaneous fluid administration is complete, sterile infusion plugs or a clean needle should be placed to protect the open ends of the fluid lines. Contaminated fluid lines should always be disposed of. If the pocket of infused fluid becomes hard or painful, clamp off the fluid line and remove the needle and reinsert in another cleaned area. Fluid volumes should be recorded in the patient's record to ensure that desired volumes are being infused. As a general rule, no more than 15 milliliters per pound should be injected at any one time. Be certain to recheck the injection site 10 minutes after fluids have been given for any signs of irritation. You have been introduced to the procedures involved with administering subcutaneous fluid therapy in the canine and feline patient. As always, any complications or concerns when performing these techniques should be addressed by the attending veterinarian. With a little patience, you will quickly become proficient with administering subcutaneous fluid.